As a technician, one of the most important things to do is to obtain a patient history and all of the proper consent forms that are needed. The first thing you want to look at would be the admission form to make sure you have all of the proper owner information and detailed history for the patient, and make sure that all the information is correct. Going into treatment, we need to make sure that we have consent to treat the animal, so that way they review anything that we're going to do. We also need to make sure they understand the risks of any off-label medications that they are giving, and sign off on that. When it comes to any kind of procedures, we need to make sure that we identify any risks that occurs during anesthesia, dentals, or any kind of surgical procedure. With all of these forms, you need to make sure that you have a signature and a date completed for all of them. When it comes to touchy subjects such as euthanasia, this is the most important factor for the form, is for them to release the pet to us from liability of the euthanasia, and just to understand all factors and to sign and date. That way everything's all clear.
When entering into a new clinic, you should always orientate yourself with the equipment that clinic has available to you. UA is typically done, and urinalysis is typically done with dipsticks, so make sure that you know how to properly read and use the dipsticks. Also, after collecting blood, make sure that you know what the proper fill level is for your tubes. That way you could use a centrifuge. Here at our clinic, we have the IDEX machines for our CBCs. When you're using the IDEX machine, make sure that you use your purple and your gray top tubes, and that they go together out of the same lot number and batching. Alright, so after you properly fill your tubes, go ahead and place them in the machine over here. It's going to get its sample, and then you're going to go ahead and put your patient information into your computer. Make sure that you got all of your tests picked that you're going to put into the computer, and then after it's been processed, it's going to give you a nice little printout. It's going to look similar to this. It's going to have your patient information here, and this is the layout of your results that you'll be able to read and give to your doctor. The other equipment that we have here in our clinic would also be your microbiology and cytology equipment. Also, you would also need to know how to do your blood smears, so you're going to need to understand the usage and cleaning care of a microscope. Also, incubators, know how to work your incubators. Everything else is pretty much basic, so there's your laboratory tests and instruments. You should always, before entering a room, check to see what procedure you will be doing on your patient that day. If it's anything like vaccinations, go ahead and get your needles ready and drop the medication that will be given that day. Double check what medicine and the patient before you draw it up, and then before you call in your patient. You want to go ahead and draw up your medication and make sure you've calculated your dosage, check it twice, all that good stuff. And then when you've finished drawing up your medication that you will be giving, go ahead and switch out your needles and put your new needle on. And then go ahead and flush the air out of that needle and clean up what's left over. And then you can go ahead and call your doctor in and let him know that your patient and his supplies is ready. And then call your patient in.
Dr. B, we're ready.
A significant skill that a technician needs is to be able to anticipate what the doctor needs. Here she has given a vaccine to a dog, and we'll see how it goes from here.
Do you have the Rimadyl for the post-op pain? Oh, thank you.
Yes.
Very well prepared. Thank you very much. Good job. Huh? Good, good. Thank you. Well, he's ready to go. You can call the client and let them know they were done with the vaccination, and they can probably pick them up sometime in the early afternoon. Thank you, Heather. You did a very good job. Well prepared. Huh?
By being able to anticipate what your doctor's needs, you can keep the flow of patients at a fast pace.
When starting your dental prophylactic procedure, the first thing you want to start out with is the oral exam. That way you can find any kind of lesions that need to be treated, any possible cancer or tumors that also need to be looked into, and any source of bleeding to go ahead and kind of pinpoint where the more serious issues are. After the examination, go ahead and start the removal of the gross calculi. Once that's done, move on to the hydrosonic scaling, and you'll want to make sure you go completely around every tooth and make sure that you get even on the inside, the hard to reach spots. After that, you want to go ahead and make sure to get the subgingival curette, and that is to help protect the health of the root. Once all that is done, move on to probing, so you can find any of the pockets and help with further treatment of possible tooth removal and any kind of infections that we might have missed. Once all that is done, go ahead and finish up with a nice polishing to take out any of those microscopic scratches that the scaling has done, and to leave them with a nice shiny pearly white. After your examination, if anything has been found, this is the best time to go ahead and get your dental x-rays done to find any kind of bone deterioration, and to find out where to go on from there. Go ahead and chart everything down, all the findings, anything that was done. Too much information is never bad. Once all that is completed, go ahead and catch up with your owner about everything that had been done. Go ahead and make sure that you stress about home health care and the importance of brushing to keep up with the dental that we had just completed. Also offer a before and after pictures. That way it reminds them of the nice pearly whites we had just given them, and it makes them want to come back and see us again.
Now with vaccines, you always want to make sure that you check your chart and pretty much double check yourself. Make sure that you are grabbing the right vaccine for the right patient, and make sure that for things like DHL, PPC, that if they need to take the lepto out or the corona out, that is done so that they don't have a reaction. Then go ahead and get it prepared. Also be aware of the different areas that things like rabies goes in one area and the DHL PPC goes in another, or the feline vaccinations go in one area versus another. That way, if a reaction does occur, we can tell which vaccination is causing that reaction. Also, we don't give vaccinations in the neck area anymore. They stay into the lower limb area, either in the shoulders or in the pelvic region, so that if a sarcoma develops, these areas are easily amputated without causing more injury or detrimental results to the animal. So stick to these areas. Make sure you know which vaccination goes in which quarter. Make sure that you check to see if they have any allergic reactions to any additional things to that vaccination, and always double check your patient and make sure that they're the right one that you're supposed to be dealing with. Hi, so another thing that you should also keep in mind as a technician is that you will also need to worry about PPE. The first things you should do is always put on your gloves. Keep a ready stock available and close to any